As we get older, our bodies become more vulnerable. It might start with small issues like leg cramps or fatigue, but it can also mean serious problems like strokes, brain bleeds, or cancer. That's why every year millions of seniors line up for checkups thinking they're protecting themselves. But in reality, the opposite may be happening. It's a hidden truth few doctors will ever admit. Studies now reveal that nearly 4 in 10 medical tests in seniors lead to unnecessary treatments, dangerous complications, or even lifelong side effects. And here's the shocking part. Almost everyone over 70 has no idea they're being over-tested. In today's video, 5 checkups to avoid and the frightening reality of what they're really doing to your body. And make you stay till the end to see which test lands at number 2. It may be the one you've already had. Let's go to the first one. Bone density scan. If you're a senior, chances are you felt leg cramps, back pain, or stiff joints. These can be early signs of osteoporosis, one of the silent enemies of aging that millions of old people encounter every year. The disease itself doesn't hurt at first, but all it takes is one slip to cause a hip fracture, months in bed, and the loss of the independence you fought to keep for years. That's why many people turn to bone density scans, also known as DEXA. I understand this test seems like the perfect solution. It's quick, painless, and non-invasive. It promises to tell you if your bones are hollow. Sounds reassuring, doesn't it? But this is exactly where the problem begins. A recent study revealed a concerning truth. Among those who received bone density scans when they weren't actually needed, a full 8.1% were still prescribed osteoporosis medication. This means that for every 12 people who get the test without proper indication, one person gets labeled with osteoporosis and has to take unnecessary medication. The problem becomes more serious when we talk about the side effects of bisphosphonate drugs, the type commonly prescribed to treat osteoporosis. These side effects include severe digestive disorders and, in rare but very dangerous cases, jawbone necrosis or unusual thigh bone fractures can occur. Imagine going for a test because you want to protect your bone health, but end up facing complications that could be more serious than the original problem, especially for people over 70 whose bodies have less ability to recover. These complications can seriously affect quality of life. So what should we do? Instead of focusing on continuous bone density measurements, experts recommend that elderly people should prioritize fall prevention. Because in reality, falling is the main cause of bone fractures in elderly people, not low bone density. You can prevent falling by keeping floors dry, clearing obstacles, adding handrails, exercising for balance and strength, getting checkups on vision and hearing, and managing medications to avoid dizziness. In case you still want to take the test, here is something to remember. Reputable medical organizations currently recommend bone density scans only for women from age 65. For men from age 70 without special risk factors, they don't recommend taking this test. But bone density scanning is just the beginning. The next test we'll discuss can cause serious psychological consequences that many families never expected. Brain MRI for memory problems. As we age, memory problems gradually appear. Your mind isn't as sharp as before. You forget names of acquaintances, misplace things. Perhaps the scariest thing is the fear of forgetting your loved ones. That's why many families often decide to take their parents for brain MRIs when they notice signs of forgetfulness. The natural reaction is wanting to scan the brain to see if there's anything wrong, for peace of mind or early problem detection. But the decision to take the brain MRI test could actually leave the whole family full of regret. And instead of fixing those psychological problems, it may even create lasting emotional scars. Why do I say that? Let's look at this number. Only less than 10% of dementia cases are treatable, and less than 1% have the potential for partial recovery. This means that in 9 out of 10 cases, MRI only confirms a disease that current medicine cannot cure. So why can knowing this information be harmful? First is the scanning process. Imagine the feeling of a 75-year-old having to lie motionless in a noisy, cramped machine for 20 to 90 minutes. For elderly people, especially those with mobility problems or claustrophobia, this is an extremely uncomfortable experience. But the worst part isn't the scanning process. The worst part is when the results come back. When seeing images of brain atrophy on the scan without effective treatment methods, both patient and family will fall into despair. Many people have told me that from the day they got the MRI results, their grandparents became depressed, lost all joy in life, and the family also lived in constant worry. Take the example of George, 74 years old, a retired engineer worried about forgetfulness. He was still sharp, but occasionally misplaced keys and forgot people's names. The doctor ordered an MRI, and results showed white matter changes in the brain. He panicked, convinced he had dementia, stopped driving and stopped going to church. But when reassessed using standard cognitive tests, his scores were completely normal. We explained that those MRI findings were age-appropriate. We helped him focus on lifestyle interventions like adequate sleep, proper hydration, and brain exercises. Within 3 months, his memory had stabilized and he felt like himself again. Brain MRI is only truly necessary when doctors suspect treatable problems like brain tumors, bleeding, strokes, or fluid accumulation in the brain ventricles. These are rare conditions, and experienced doctors will know when to order MRI based on specific clinical signs. From seemingly harmless tests, we'll move to a test that many consider safe for checking heart health, but may actually trigger the very heart problems it's trying to detect. Cardiac stress tests. The third test I want you to consider is cardiac stress test. Many people think cardiac stress tests are a safe way to check heart health. Even some doctors regularly order this test for elderly people as part of routine health checkups. But the reality is completely opposite. For people over 70 without clear heart symptoms, this test can trigger the very heart problems it's trying to detect. How does this test work to pose such risks? In stress testing, you'll be asked to walk on a treadmill or pedal a stationary bike with gradually increasing intensity. The purpose is to push the heart to work at maximum levels to see if there are any abnormalities. Sounds reasonable, right? But this very process pushes the body to a risky point and can cause serious problems if the heart works too hard. Though rare, when it occurs, it's very dangerous. The stress can rupture atherosclerotic plaques in coronary arteries, leading to complete blockage and even a heart attack right in the testing room. If you're over 70, the risks become even greater. Older adults often have underlying conditions like high blood pressure, diabetes, or hidden coronary artery disease. Their bodies also have less ability to handle sudden strain, and many take medications that can alter heart response during stress. On top of that, stress tests in this age group often produce false alarms. Studies show the false positive rate in adults over 70 can be as high as 40%, meaning the test suggests a problem when there isn't one. That can trigger a cascade of follow-up procedures, from angiograms to unnecessary stents or bypass surgery. Let me tell you about David. He's 75, a retired postman who still walked every day. Sometimes he felt a bit tired on hills, so his doctor sent him for a stress test. The results weren't clear, so they did a catheterization and put in a stent for a mild narrowing. That night, he reacted badly to the dye, his kidneys took a hit, and he spent almost a week in the hospital. Weeks of follow-up later, his fatigue was still the same, because his heart was never the problem. All he really needed was more water and a little more rest. So, how can we assess heart health more safely? Actually, the best measuring tool is right near you, your own body and fitness level. Johns Hopkins research has shown an important fact. For people over 70, fitness is a much better predictor of survival than the number of cardiovascular risk factors they have. This shows that focusing on lifestyle and regular appropriate exercise can provide more benefits than a risky periodic stress test. Next, we'll move to a procedure where complication risks increase significantly with age, but benefits actually decrease sharply. Colonoscopy. What I want to talk about is colonoscopy, a common test to screen for and prevent colorectal cancer or diagnose other conditions like ulcers or inflammatory bowel disease. This is a test that many people still absolutely trust, but after age 70, especially 75, it becomes a double-edged sword, with risks increasingly outweighing benefits. How? First, I want to share an alarming number that many people may not know. A 2022 study showed that elderly people have a 30% higher risk of bowel perforation compared to younger people when undergoing colonoscopy. Even more concerning, this risk is 14 times higher than people of the same age who don't have colonoscopy. Bowel perforation in elderly people is no joke. It often leads to serious infections that can be life-threatening. But bowel perforation is just one of many risks. If you're over 70, you'll need to consider these complications: difficult to stop bleeding, cardiovascular complications from stress, and serious side effects from anesthesia used during the procedure. Elderly bodies no longer have the recovery ability they once had, so each complication can become a major problem. What few people know is that the bowel preparation process before colonoscopy also poses dangers. To clean the bowel, patients must drink large amounts of laxative solution in a short time. This causes severe and continuous diarrhea, making the body lose large amounts of water and important electrolytes like sodium and potassium. Elderly people are particularly prone to dehydration due to decreased thirst sensation and declining kidney function. When electrolyte balance is lost, they may become confused, have seizures, or even fall into a coma. Potassium imbalance can cause muscle weakness and serious heart rhythm disorders. But perhaps the biggest question to ask is, are the results worth these risks? A 2006 study showed that colonoscopy benefits decrease sharply with age. In people 80 and older, detecting and treating colon cancer only extends life by 0.13 years, about 1.5 months, compared to 0.85 years in the 50-54 age group. The effectiveness is only 15%. That's why the U.S. Preventive Services Task Force has recommended stopping routine screening after age 75. They recognize that the risk-to-benefit ratio is no longer reasonable. So can we replace this with a safer method? Instead, consider the fecal immunochemical test, FIT. This is a simple, non-invasive method that can be done at home and still provides accurate results. You can buy FIT tests without a prescription, but should discuss with your doctor first to ensure you're using the most appropriate type of test. So that's the fourth test I want you to consider. Now, we'll talk about perhaps the most dangerous test on our list, a test that many consider comprehensive, but may actually create the very disease it's trying to detect. Annual full-body CT scans. The final and perhaps most dangerous test on our list is annual full-body CT scans. This is the type of test that many consider comprehensive, detecting everything, but may actually create the very disease it's trying to find. When looking at the data from the Cancer Research Institute, I was shocked. The FDA has warned that a CT scan exposes you to radiation hundreds of times higher than a chest X-ray. This radiation slightly raises the risk of cancer, but the bigger problem is when large numbers of healthy people get whole-body CT scans with little benefit, especially if they repeat the exam every year. In that case, the overall effect on public health could be harmful. An article on the Times reported that about 103,000 cancer cases in the US each year may be linked to CT scans, making up as much as 5% of all annual cancers. Put simply, 1 in every 20 people with cancer may have gotten it from unnecessary CT scans. For older adults, the risk is even more serious. Even though they are older, they still may have many years ahead, so the radiation from repeated scans can build up over time. CT scans use ionizing radiation, which damages DNA in cells. The body can repair some of this, but not all. The unrepaired damage collects year after year, which can eventually turn into cancer. But the danger doesn't just come from radiation. Full-body CTs often detect incidental abnormalities called incidentalomas, usually benign tumors or cysts with no clinical significance. However, these findings lead to a chain of additional tests, biopsies, even completely unnecessary surgery. I remember Helen, an 80-year-old widow with mild pelvic pain. Her doctor ordered a contrast CT just in case, which revealed a harmless 1.5 centimeter adrenal lesion. But the dye strained her kidneys, spiked her creatinine, and led to 2 hospital stays, all from an ache that would have faded in days. From this case, I really believe that contrast CTs should be reserved for urgent cases like stroke, severe trauma, or specific cancers. For minor issues, ask about safer options like MRI without contrast, ultrasound, or watchful waiting. The FDA also stated that there is no scientific evidence showing that full-body CT provides benefits for people without symptoms. They even prohibit CT machine manufacturers from advertising its use for screening in healthy people, except for some special cases like Li-Fraumeni syndrome, a rare genetic mutation, or multiple myeloma. Annual full-body CT screening is completely not recommended. And that is the last test I want you to reconsider before taking. Now, I know what you're thinking after hearing about all these risks. It can feel overwhelming to question medical tests that we've been told are routine or preventive. But here's the thing. Being informed about these risks actually puts you in control of your healthcare decisions. So, what should you do? The question I get asked most often is, if these tests can be harmful, how do I know when to say yes or no to my doctor? This is not an easy decision at all, especially when we're accustomed to following all doctors' orders. But remember, you have the right to make choices about your body based on complete information. Here is what I recommend you doing. Elderly people should consider refusing these tests when there are no clear symptoms, and instead of focusing on searching for hidden diseases, people over 70 should prioritize what's truly important. Maintaining quality of life, exercising appropriately for their ability, managing existing chronic diseases well, and enjoying time with family. But what I want to emphasize is that the decision to do or not do tests needs to be discussed frankly with doctors. Ask important questions. How will this test change my treatment approach? What are the specific benefits and risks? What will happen if I don't do this test? Are there safer alternative methods? Please share with your doctor your wishes and priorities. If your goal is to enjoy time with family and maintain independence, then tests that may cause anxiety, complications, or limit activities may not be appropriate. Finally, remember that the goal isn't to live as long as possible at any cost. The real goal is to enjoy the remaining years with the highest quality, happiness, and meaning possible. Sometimes saying no to a test is exactly the way to protect that. And there you have it, 5 medical checkups that may look helpful on the surface, but could do more harm than good, especially after age 70. Medicine today is powerful, but far from perfect. Always remember to ask yourself if any test is actually necessary before taking them. And it's also wise to keep in mind that true health comes from healthy habits. Now, I'd love to hear from you. Have you, or someone close to you, ever dealt with complications from a medical test or treatment that wasn't truly needed? What happened? Share your stories and thoughts in the comments below. We're eager to hear, and I'll see you in the next video. Goodbye.